to happen when the person does eventually get out of bed. Ways to prevent these complications are, again, make sure the person is as active as possible. Use footboards or pillows against the feet while the person is in bed to keep the legs in good alignment. Range of motion exercises are very important to help prevent these deformities. How to perform this range of motion exercise will be covered in detail in another videotape. Another system is the cardiovascular system. Limited mobility impacts the heart and blood vessels which make up this cardiovascular system. There is a change in our body's response when we go from a lying to a sitting position. Have you had the experience of jumping out of bed quickly and feeling suddenly lightheaded, dizzy, faint? Maybe you feel like there are stars in front of you. This happens more often in elderly as their cardiovascular system takes longer to adjust to changes in position. This is called orthostatic hypotension, and it's caused by a decrease in blood pressure that results from position changes caused by poor blood vessel tone. Moving patients from a lying to a sitting position needs to be done slowly, allowing the cardiovascular system to adjust to the change in position. If it's not done, the patient is at an increased risk for fainting, losing their balance, and falling out of bed. Immobility also increases the workload of the heart as more blood circulates to the heart in the lying position than when the patient is sitting or standing. This increased workload on the heart can cause congestion in the heart as well as heart damage. Immobility also decreases the flow of blood through blood vessels, particularly the blood vessels in the legs. This slowing of blood flow can cause blood clots. These blood clots are called thrombi. Because of the ever-increasing number of people who are traveling by air, health professionals are now advising travelers to move about in the cabin when possible because of the increased reports of blood clot development from pressure changes in the cabin, but more importantly, from the amount of prolonged sitting on long flights. Thrombi can break loose from the blood vessel and travel to other vital organs such as the heart, brain, or lungs, or other vital parts. This in turn can cause heart attack, stroke, or other potentially life-threatening development. The healthcare assistant can help prevent these problems by changing the patient's position slowly when they go from a lying to a sitting position. Dangle a patient prior to having them stand. Dangling involves having the patient sit at the edge of the bed before standing, giving their body time to adjust to the position change. Leg and foot exercises are also important ways to prevent these problems from occurring. It causes the muscles of the legs to expand and contract, moving the blood along to prevent pooling and blood clot formation. I'd like you now to watch leg and foot exercises as they are demonstrated. Adjust the bed to a comfortable working height. Raise the head of the bed to about 45 degrees, sometimes called semi-Fowler's position. Explain the purpose of leg and foot exercises to the patient. Lower the side rail on the side you will be working. Then fold the top linens to the foot of the bed, making certain that the patient is modestly covered. Have the patient rotate each ankle 3 times clockwise, followed by 3 times counterclockwise. Repeat 3 to 5 repetitions. Then have the patient rotate each leg, drawing imaginary circles in the air, 3 times clockwise, followed by 3 times counterclockwise. Caution, this exercise may not be appropriate following hip surgery, so be certain to check with the nurse before doing. Have the patient slide one leg up and then down while in bed. Do the same with the other leg. Repeat 3 to 5 times. Finally, have the patient curl their toes down, then up. Repeat 3 to 5 times. Encourage the patient to repeat these exercises every 1 to 2 hours while awake. Now draw the bedding up and raise the side rails. Lower the bed to its lowest position. Document that the exercises were done and be certain to report to the nurse if the patient experienced pain or discomfort during the exercises. The last measure that I'll be discussing to prevent cardiovascular complications is the application of elasticized stockings. These stockings are more commonly referred to as TED stockings. This measure does require a physician order, but when ordered can be extremely beneficial to the patient by providing support to the legs, and it also can help speed the flow of blood from the veins in the legs back to the heart again. Now I would like you to watch as application of these stockings is demonstrated. Obtain elasticized stockings as ordered by the physician. Accurate measurement for appropriate fit needs to be done prior to its application. Explain to the patient what you will be doing and the purpose of wearing these stockings. Always apply stockings with the patient lying rather than sitting. Adjust the bed to a comfortable working height and lower the side rail. Expose one leg at a time. Grasp the stocking with both hands at the top and roll towards the toe end. Remember that the raised seams should be on the outside, not next to the patient's skin. Slip the stocking over the patient's toes, positioning the opening at the base of the toes.